everyone, this is Tara again, and we are now on the page about the autism spectrum. On this page we will be delving into the definition, etiology or cause, prevalence, and incidence. So here we will start with the definition. Just to preface again, I will be looking to the side in the video because I will be looking into the information as I record it for you. So on to the definition. Autism spectrum disorder, brackets ASD, is a complex neurobiological condition that can affect the normal function of the gastrointestinal, immune, hepatic, endocrine, and nervous systems. It impacts normal brain development, leaving most individuals with communication problems, difficulty with typical social interactions, and a tendency to repeat specific patterns of behavior. There is also a markedly restricted repertoire of activity and interests. Individuals on the autism spectrum tend to have varying degrees and combinations of symptoms, therefore treatment needs to be specific to the individual. So keep that in mind, everybody's different, right? So on to etiology. There is some debate as to whether genetic or environmental factors play a role in the development of autism spectrum disorders. One thing for certain is that children with ASDs have many differences in brain structure and chemistry than typical children. Using MRIs, the measure of skeletal circumference Using MRIs and measures of skeletal circumference researchers have determined a trend of early brain overgrowth in children with ASDs. The period of overgrowth occurs within the first 1 to 2 months and 6 to 14 months of childhood. Increased brain volume is consistent with systems of autism. Why would this be? As a child matures, the brain undergoes a process of synaptic pruning, in which neuronal connections in the brain that are not used degenerate or disappear. In children with ASDs, pruning does not happen. Instead, there are an abundance of synapses left in the brain that creates an abnormal organization of neural connections. And after this, there's just a quick set of images. The first is the synapses of a typical child, and it's a quick diagram. And in this diagram, you see at birth, there aren't many neural pathways. Then after 6 years, there are quite a few. And then at 14 years, there's an obvious depletion in that. So it's just a visual representation. The second diagram is the synapses of a child with an ASD. It starts out with not many neural pathways, a few less than the first. And after 2 months, there are millions. And then after 4 months, there are even more than that. It's basically covered. So there's definitely a massive difference between the two. So I'm just going to go into some theories as to possibly what the cause might be. However, many of these aren't proven. So the first one that's being looked into is neuroimmune dysfunction syndrome, or NIDS for short. This is an area that is currently being researched, and treatment has seen the symptoms of autism relieved in patients. So this may be something that we're looking into now. Some people do believe that vaccinations at an early age are causing autism. So that's something that is sort of being looked into. Some studies indicate that children who receive the measles, mumps, and rubella vaccinations display symptoms shortly afterwards. So parents are beginning to refuse vaccinations, but there's no clear and consistent association between vaccinations and the onset of the symptoms. So take that as you will, it still isn't proven. As for genetics, there may be some indications that autism runs in families. Only fragile X syndrome and Rett syndrome have been proven to be due to genetics. So it is still not proven. Some believe that the environment is a cause, so exposure to pollution, toxic compounds, and processed foods combined with vaccinations and viral infections are believed to develop the symptoms of ASDs. However, once again, this is not proven. There have been some looking into pregnancy as part of the cause, maybe. The first, basically, Pitocin, which is a drug administered to induce labor, may be associated with the child developing autism. Poor diet and changes in hormonal or immune functioning and yeast infections during pregnancy may also be contributing factors, and research in this is ongoing. Now I'm going to move on to prevalence. In 1991, the prevalence of ASDs was 3 out of 10,000 students. By 2001, there was an increased prevalence of ASDs with a rate of 44 out of 10,000 students. Currently, ASDs are prevalent in 66 out of 10,000 students, and the main reason for this increase in prevalence can be attributed to the fact that causes of ASDs may have been underdiagnosed in the past. And it's interesting because boys have significantly higher chance of having ASDs than girls, and 4 out of 5 children with autism are males. And only 56% of children with autism tend to finish high school. So this is a problem we definitely need to look into, especially as educators, as most of you possibly may be who are visiting our website. This is something we're trying to, get rid of. We want our students to get through school, especially, students with autism should have the exact same treatment, and they should be able to get to the place they need to be, and I don't believe that place is failing school. Just to move on to incidence now. 10 years ago, the accepted rate of incidence for ASDs was 4 to 5 diagnoses out of every 10,000 people. Now, the rate is approximately 1 out of every 100 people. 1 to 1.5 million Americans are living with ASDs. It is the fastest growing developmental disability with a growth rate of 1/148% per year. So it's getting bigger, and we need to look into that. Thank you, and I hope this page was enjoyable for you, and I guess I'll see you on the next pages. Thanks. Bye.